Greetings and salutations, dear viewers. Get ready for some fantastic content. Hello, YouTube friends. Join us as we unravel the mysteries surrounding National Action Alliance for Suicide Prevention. The National Action Alliance for Suicide Prevention Action Alliance is an American suicide prevention organization coordinating national efforts to advance the National Strategy for Suicide Prevention (NSSP). It is a public-private partnership that, according to them, catalyzes planning, implementation, and accountability for updating and advancing the NSSP. The Action Alliance works on the 2001 National Strategy for Suicide Prevention and is an outgrowth of the Suicide Prevention Resource Center. The Action Alliance initially focused on 3 high-risk populations: LGBT youth, American Indian-Alaska Natives, and military veterans. Part of the group's campaign will be to educate on the warning signs of suicide, promoting the National Suicide Prevention Lifeline 1-800-273-TALK or 988 in the US, as well as community crisis clinics across the US. Part of the Action Alliance's work is to identify culturally appropriate interventions to serve various minority populations. Clinical social worker Kathleen Ryan, whose work has been recognized by numerous organizations, including the Action Alliance, explains that these are interventions that address multiple aspects of people's lives, such as ethnicity, culture, language, socioeconomic status, and religious diversity in providing services, where they are to explain our findings and family approach in ways that cross language and cultural barriers. In December 2011, Action Alliance partnered with Substance Abuse and Mental Health Services Administration (SAMHSA), a branch of the U.S. Department of Health and Human Services, and Facebook to offer a new service to help offer suicide crisis worker access to users who were flagged by others for posting suicidal comment. The person who posted the suicidal comment will then immediately receive an email from Facebook encouraging them to call the National Suicide Prevention Lifeline at 1-800-273-TALK 8255 or to click on a link to begin a confidential chat session with a crisis worker. Get ready for an exciting exploration as we unravel the mysteries of mission. The mission of the Action Alliance is to advance the 2001 National Strategy for Suicide Prevention by identifying suicide prevention as a national priority, catalyzing efforts to implement high-priority objectives of the NSSP, and cultivating the sources needed to sustain progress. With the foundation laid, let's embark on a journey into task forces. The Action Alliance has 14 task forces. Infrastructure task forces include the Data and Surveillance Task Force, the National Strategy for Suicide Prevention Task Force, and the Research Prioritization Task Force. High-risk populations task forces include the American Indian-Alaska Native Task Force, the LGBT Populations Task Force, the Military Veterans Task Force, the Suicide Attempt Survivors Task Force, and the Survivors of Suicide Loss Task Force. Interventions task forces include the Clinical Care and Intervention Task Force, the Clinical Workforce Preparedness Task Force, the Faith Communities Task Force, the Public Awareness and Education Task Force, the Workplace Task Force, and the Youth in Contact with the Juvenile Justice System Task Force. Get ready to immerse yourself in the world of LGBT populations as we examine its impact and relevance. Although first focused on suicide among LGBT youth, the LGBT lesbian, gay, bisexual, transgender task force expanded to include LGBT of all ages, acknowledging the struggles with suicide idealization, suicide attempts, and death by suicide that many LGBT people confront at different points in their lives. The initial leaders of the task force were Charles Robbins, head of the Trevor Project, which operates a nationwide LGBT youth suicide prevention program, and Kevin Jennings, the then Department of Education's Assistant Deputy Secretary for the Office of Safe and Drug-Free Schools. Jennings, an openly gay appointee, founded the Gay, Lesbian and Straight Education Network GLSEN. Now, let's shift our perspective and explore American Indian and Alaska Native through a fresh lens, unlocking new perspectives. The American Indian and Alaska Native Task Force has coordinated two National Action Summits August 2011 in Scottsdale, Arizona, and October 2011 in Anchorage, Alaska. The task force is led by Ibet Rabidhan, Director of Indian Health Service, United States Department of Health and Human Services. The summits focused on the importance of collaboration among tribal, federal, state, and community and program-level leadership to promote American Indian and Alaska Native behavioral health. In this segment, we'll be unraveling the complexities of military and veterans and exploring its multifaceted nature. The Military and Veterans United States Department of Veterans Affairs Task Force is co-chaired by Jan Kemp, Vision Center of Excellence for Suicide Prevention. The task force will join Department of Defense DoD and Department of Veterans Affairs via suicide prevention programs already in progress. In doing so, suicide prevention programs aimed at military personnel will combine approaches from both public and private sectors into a single effort. Get ready for an exciting part as we dive into Executive Committee. The initial Executive Committee was nominated by the general public and reviewed by a nominating committee of suicide prevention leaders from both the public and private sectors. Candidates were selected based on criteria including: do they bring a needed perspective to suicide prevention? Can they leverage change at the national level? And can they uniquely contribute to the Executive Committee? Since the September 2010 launch, new candidates are reviewed by the nominating committee and finalized by the co-chairs. As of 2012, the Leadership Committee as listed from the organization's website. Co-chairs: Public Sector Co-Chair, John M. McHugh, Secretary of the U.S. Army. Private Sector Co-Chair, Gordon H. Smith, President and CEO, National Association of Broadcasters. Full members: Luther J. Arnold, Senior Pastor, United Church of Santa Fe. Carl Bell, MD, President and CEO, Community Mental Health Council. Tom Berger, Executive Director of the Veterans Health Council, Vietnam Veterans of America. Andrew Bertagnelli, FT. National Director, Virtual Behavioral Health, One Medical and Associate Professor, Alliant International University. Brian Boone, President and CEO, Commission on Accreditation of Rehabilitation Facilities. Robert Certain, Director, the Episcopal Church at St. Peter and St. Paul. David Covington, Vice President, Adult and Youth Services, Magellan Health Services. Judy Cushing, President and CEO, Oregon Partnership. Mary Durham, Vice President, Kaiser Permanente. Brian Diak, President and CEO, Entertainment Industries Council, Inc. Saul Feldman, Chairman Emeritus, United Behavioral Health. David Grossman, Medical Director, Preventive Care Group Health Research Institute. McClellan Hall, Executive Director, National Indian Youth Leadership Project. Jack Heath, Founder and CEO, Inspire United States of America Foundation. Andrew Lane, Executive Director, Johnson Family Foundation. Beverly Malone, CEO, National League for Nursing. Walter A. McNeil, President, International Association of Chiefs of Police. Jamie Moyer, Co-founder, Moyer Foundation. Karen Moyer, Co-founder, Moyer Foundation. Jerry Reed, Director, Suicide Prevention Resource Center. Phil Sato, Representative, National Council for Suicide Prevention. Paul M. Shive, Senior Vice President, Healthcare Improvement, The Joint Commission. Joe Sullivan, Chief Security Officer, Facebook, Inc. Robert W. Turner, Senior Vice President, Corporate Relations, Union Pacific Railroad. Eduardo Vega, Executive Director, Mental Health Association of San Francisco. Mary Hayashi, Chair, Assembly Business, California Professions and Consumer Protection Committee, California State Assembly. Michael Hogan, Commissioner, New York State Office of Mental Health. Pamela Hyde, Administrator, Substance Abuse and Mental Health Services Administration. Robert Jesse, Principal Deputy Undersecretary for Health, United States Department of Veterans Affairs. Mary Lou Leary, Acting Assistant United States Attorney General, Office of Justice Programs. Ex officio members: Regina Benjamin, Surgeon General of the United States, Office of the Surgeon General. Thomas Frieden, Director Centers for Disease Control and Prevention Kathy Greenlee, Assistant Secretary for Aging Administration on Aging Thomas Insel, Director National Institute of Mental Health Howard Kelvin, Co-Assistant Secretary for Health United States Department of Health and Human Services Yvette Rabler, Director Indian Health Service Mary Wakefield, Administrator Health Resources and Services Administration. Leave a comment below and let me know what you thought of this video.